Heart disease continues to be the leading cause of death in the United States, fueled by rising rates of high blood pressure, obesity, and other major risk factors. Despite medical advancements that have helped many people live longer with cardiovascular disease, the underlying health issues contributing to heart attacks and strokes are only getting worse. According to the American Heart Association's latest report, nearly half of U.S. adults now have high blood pressure, over 70% have excess weight, and more than half are living with prediabetes or type 2 diabetes. If these trends continue, heart disease will claim even more lives in the coming decades, and the financial burden of cardiovascular care will skyrocket. The numbers are alarming. In 2022 alone, cardiovascular disease was responsible for nearly 1 million deaths in the U.S., an increase from the previous year. Even though overall death rates from heart disease have stabilized after a spike during the COVID-19 pandemic, the risk factors driving these deaths are continuing to grow. Obesity is now a bigger threat to public health than smoking, contributing to as many as 1,300 additional deaths per day. Excess weight is linked to higher rates of high blood pressure, diabetes, and kidney disease, conditions that, when combined, dramatically increase the likelihood of a heart attack or stroke. These issues are not just affecting older adults. An increasing number of children and young people are also living with unhealthy weight and metabolic conditions, setting them up for serious health problems later in life. While some progress has been made in reducing smoking rates and improving cholesterol management, the growing burden of obesity and diabetes threatens to undo these gains. By 2050, it is projected that more than 180 million U.S. adults will have high blood pressure or obesity, while over 80 million will have diabetes. These trends will place an enormous strain on the healthcare system, with costs related to cardiovascular disease expected to triple. Even more concerning is the fact that not all populations are affected equally. Some communities face significantly higher rates of heart disease risk factors due to disparities in healthcare access, economic inequality, and social determinants of health. Without targeted interventions, the gap in cardiovascular health outcomes will only widen. Medical advances have made it possible for people to survive heart disease, but survival is not the same as prevention. The rising prevalence of obesity, high blood pressure, and diabetes means that more people are being diagnosed with chronic health conditions that will require lifelong management. Even new medications and treatments can only go so far if the root causes of heart disease are not addressed. Experts warn that without urgent action to improve public health policies, promote healthier lifestyles, and expand access to preventive care, heart disease will remain a major killer for years to come. The time to act is now, before more lives are lost to a disease that is, in many cases, preventable.